The mission of the Kentucky Children's Hospital's mobile clinic is to empower patients where they are and bring state-of-the-art healthcare services to those communities that lack those services so they can be a part of the UK healthcare family. Hi, my name is Mej Jabour, and I'm the practice manager for the Kentucky Children's Hospital's Colonel Harland Sanders Foundation Mobile Clinic. So this started more than 3 years ago with Dr. Scotty Day, the chair of pediatrics, reaching out to our donors, who were not our donors back then, and they graciously accepted. And in 2020, UK Healthcare received a grant, or multiple grants, to start the mobile clinic, and that's when the journey for that mobile clinic began. And UK placed that order, and after 2 and somewhat years, the clinic arrived. Kentucky Children's Hospital realized there was a need for specialty pediatric care throughout the state, just due to a lot of financial hardships, transportation challenges that patients have within those communities, mainly outside of Lexington or in the rural parts of the state. And they wanted to be there for those patients. And what best way other than a mobile clinic to go out there and provide that care for them. The care that the mobile clinic makes available to our kids throughout the state are pediatric cardiology, pediatric hemophilia, high BMI, Hep C, ophthalmology, eye screenings, adolescent medicine, and we plan on expanding to GI, neurology, urology, and focus a lot on specialty care. We would like to focus on general pediatrics in terms of sports physicals and wellness child visits. So the geographic areas that the mobile clinic serves are mainly within the Bluegrass area and also other rural areas that we'd like to go to. So currently, we plan on going to areas in East Kentucky, Southeast Kentucky, and places that are underserved within Lexington. So places that we're already going in, places we already have agreements with those organizations to go and provide excellent pediatric care. And we also have other plans in the pipelines that we plan on going to, specifically in Eastern Kentucky, far east side of the state, and also western part of the state. What makes the mobile clinic kids friendly is first and foremost our amazing staff that work on it. Everyone from the medical staff to the frontline staff to IT to marketing to our donor relationship folks, everyone who got involved, telehealth. It's just amazing to work with those people. They're all extremely mission driven. Our internal and external wrappings make it not only a kids-friendly area that's friendly for kids, it's also friendly for adults and people who would be willing to work on that mobile clinic. Also included in the mobile clinic are sensory items, which make it extremely attractive for families with kids who have developmental needs such as autism, ADHD, and other behavioral needs. In times of emergency, especially what we see throughout the state, unfortunately, flooding, biohazard spills, tornadoes, we would like to utilize the mobile clinic and deploy it in those areas so it can provide aid for the people over there. And so we created an emergency committee that will meet with the incident command committee that UK Healthcare has and work together so that we can do it in a timely manner and deploy those resources at the time that people need them. What makes the mobile clinic staff and providers special is that they're extremely patient and pediatric centric. So it's all about the kids. We always say it all the time. These are people who dedicated their entire life to working with kids and pediatric populations, whether it's our medical staff and the providers who all the other clinics graciously provide us with. These are amazing folks. They love kids. Kids love to be around them. And we see that with the patient experience what the feedback we get from those patients, their parents, their guardians, what they tell us about the great experience they had at the mobile clinic. What makes me excited every day to wake up and come to work is the drive and the amazing team that I get to work with. I mean, it's just phenomenal. Everyone from whether it's my boss, whether it's the people I work with, my colleagues, everyone I always tell people there's a part of me in that mobile clinic and there's a part of everyone who worked on that mobile clinic in that clinic itself, because we all feel like we built it from scratch. The fun fact, the mobile clinic arrived at UK same day that I did. And I just arrived there 45 minutes before it did. And that creates a special connection. I saw an opportunity to start something extremely new, and I wanted to build it in a way that is long lasting. I'm not gonna be here my entire life, and there are other people who are gonna come and pick it up, new generations. I wanna create something for those new generations. I wanna create something, and I say I, but it's actually we, create something for not only the people who are going to work on the mobile clinic in the future, but the people it's going to provide care to. We want a long relationship, a long-lasting relationship, whether with our community partners, our patients, our staff, everyone involved in this clinic. And I think this would be a great opportunity where UK starts something as brand new as this.